There almost became a state competition for this because Florida, about 2 years after we introduced it in '06, raised the rates that kids could stay on their parents' plan to age 30. And then, not to be outdone, the Garden State of New Jersey decided to raise it to age 31. At which point you have to wonder, at least, how long are kids going to have to stay at home before they get a job? But there was a little competition, apparently. So let's talk a little bit about where we are in Connecticut. Moore also mentioned this as well. We have about 9.6% uninsured in the state, or about 344,000. This actually puts us at the low end. When you look at states in the South in particular, it's not at all uncommon to see uninsured levels of 20%. In fact, 1/3 of the total uninsured in the country reside in 3 states: Florida, Texas, and California. It's 19%, close to 20% uninsured in Florida. It's 26% in Texas and 19% in California. So, but if you look at that whole band of states, it's from Mississippi, Arizona, Alabama, and I've talked to the governors of most of those states in my prior life. It really all hovers around that 19% level. And that's an issue whether you can argue whether that's a good thing or a bad thing, but that's clearly the facts, and that's where we see high preponderance, of course, as a percentage of the uninsured. We have, our goal, quite frankly, is to reduce that dramatically. That's not going to happen quickly. It's not going to happen next year. It's not going to happen in the next 3 years. But over the next 4 to 5 years or so, I think it's realistic to bring that level down into the 2 to 3% range, which would keep us basically consistent to where Massachusetts is. Massachusetts is actually at 1.9. And frankly, would keep us consistent with the rest of the G20 countries. Because if you look at the industrialized world, no one's at 0% uninsured. So Switzerland, Holland, Germany and such are all in about 2%. So 2% seems to be the norm for the G20. And frankly, I think 2 to 3 is realistic for us. But again, this is going to take time. And one of the challenges in the whole implementation of the Affordable Care Act, outside the fact that it is a somewhat irrational implementation because it's a 3-year IT implementation being done in 10 months, is just there's all these wild expectations about what this is going to do. And the reality is that it's going to be complicated. Medicare took years in order for that to stabilize. Medicare Part D, for any of you that either knew people or such that were impacted by that, took 3 to 4 years to stabilize. That's going to be the same thing with this. Unfortunately, because next year's an election year, it's going to be great fodder for people on the left and the right. So you'll see this quite a bit. We've got almost 600,000 folks on Medicaid in our state. With the expansion of Medicaid eligibility going up to 138% of the federal poverty level, we should be adding roughly 75,000 or so of newly Medicaid eligible folks to our ranks over the next couple of years. And in total, for next year, we expect somewhere in the order of 100 to 130,000 people of the uninsured being newly insured. So these would be folks in a combination of roughly 100,000 coming into the exchange and roughly 30,000 going into Medicaid. So what's an exchange? Well, frankly, an exchange is essentially a free market, pro-competition means to buy health insurance in the same way people buy other consumer products. So whether it's a smartphone, or it's a laptop, or looking to get an airline ticket, or buy a car, it's applying the same type of pro-consumer concepts of information transparency,